Hey guys, once again welcome back to my YouTube channel Inside Organon. In today's video, I'll be sharing with you 20 important short notes which are most frequently asked in your gynecology examination. As you already know this from the topic, I also have a good news to share with you all which I'll be sharing with you later in this video. So yes, let's get started. Moving on, the next topic is chocolate cyst, which is most frequently asked in your examination as a short note. Moving on, the next topic is vaginitis. Inflammation of vagina is known as vaginitis. There are various types of vaginitis. So all those questions are most frequently asked in your examinations. Moving on, the next topic is moniliasis, which is again another question from the chapter of pelvic infections, which is most frequently asked in your examination. Moving on, the next topic is leukorrhea. Friends, leukorrhea is a discharge which is most frequently seen in most of the gynecological outpatient departments. Many of the patients जो आपके पास आते हैं वो कंप्लेन करते हैं ल्यूकोरिया की. So this is again another very important short note for your examination. Moving on, intrauterine contraceptive devices. Contraceptives are very useful for preventing STDs. Same way जो IUCDs होते हैं, that is intrauterine contraceptive device, these have very important role when we talk about contraceptives. So these are also very frequently asked in your examinations as short notes. Moving on, tubal patency test. Friends, tubal patency test is also very important for your examination. Moving on, the next topic which is episiotomy. ये topic जो है ये obstetrics का है, but sometimes these topics are also asked in your examination as short notes. The next topic is hyperemesis gravidarum. Hyperemesis gravidarum is the excessive vomiting that a female encounters during her early pregnancy. So this is also asked in your examination as short note. Moving on, the next topic is dilatation and curettage, which is also most frequently asked in your examination as short notes. Moving on, pap smear test is another test which is most frequently asked in your examination. Friends, up till now, we have seen that tubal patency test has been asked and also pap smear test. So friends, yes, this is the time to share the good news with you all. Inside Organon, on your request, has started another channel about allied subjects that I have mentioned in the I link as well as in the description below. So do check out that channel. मैंने अभी तक आपके साथ जितने भी शॉर्ट नोट्स शेयर किए हैं वो सारे शॉर्ट नोट्स विद इन अ वीक मैं कवर करने वाली हूँ उस चैनल पे. तो अगर आप चाहते हैं इन सारे शॉर्ट नोट्स एज वेल एज अदर अलाइड सब्जेक्ट्स को प्रिपेयर करना तो प्लीज़ हेलो मेडिकोस को ज्वाइन कीजिए. Now moving on to the next topic, adenomyosis is a condition where the endometrium is present inside the myometrium. Endometrial cells and stroma are present inside the myometrium. This is known as adenomyosis and it is also very important for your examinations. Moving on, carcinoma cervix has also been asked many times as short notes as well as in the long answer type questions in your examinations. Moving on, if you are preparing for gynecology examinations, do not forget to prepare pelvic abscesses because these are very frequently asked in your examination. Moving on, the next topic is cervical erosion, not just as a short note, but also in many of the examinations, this topic has also been asked as a long answer type question. This topic is also known as cervical ectopy. Most of people get confused और वो correct answer नहीं कर पाते, so you should note it down that cervical erosion is also known as cervical ectopy. Moving on, retroversion is another very important short note for your examination. Moving on, the next topic is uterine polyp. यूटेराइन पॉलिप, यूटेराइन फाइब्रॉइड्स, दिस आर फ्यू ऑफ द इम्पॉर्टेंट क्वेश्चंस जो कि ना सिर्फ शॉर्ट आंसर टाइप क्वेश्चन बट ऑल्सो लॉन्ग आंसर टाइप क्वेश्चंस भी कई बार पूछे जाते हैं. Moving on, the next topic is hirsutism, in which you have to explain about the excessive growth of hair or male pattern of the hair when it is found in the women's. So this topic is often asked in association with PCOS, which is polycystic ovarian syndrome or polycystic ovarian disease, which is again a very important topic for your examination. Moving on, the next topic is menopause. Menopause has most frequently been asked in your examination because starting from the puberty till the menopause, जो भी changes एक फीमेल की बॉडी में आते हैं menopause के दौरान, जो hot flashes देखने को मिलते हैं, bones का जो destruction होने लगता है और भी कई चीजें देखने को हमें मिलती हैं. So all these topics can be studied during examination under menopause. Moving on, the last but not the least topic is dysmenorrhea. Dysmenorrhea is the painful menses which is most frequently seen in outpatient departments that females are complaining of such issues. There are types of dysmenorrhea. One of them is spasmodic type. The another one is congenital. That is due to congestion. So both of these types of dysmenorrhea are also very important for your examination. So friends, this is all about today's session. I hope you like this video. Friends, आपको आई लिंक पे हमारा नया चैनल फ्लैश होते हुए दिख रहा होगा. तो अगर आप चाहते हैं कि जो भी शॉर्ट नोट्स मैंने आपके साथ डिस्कस किए हैं विद इन अ वीक मैं वो सारे शॉर्ट नोट्स एज वेल एज लॉन्ग आंसर्स जो भी अलाइड सब्जेक्ट्स में पूछे जाते हैं, आई ट्राई टू कवर देम ऑल विद इन अ मंथ. तो आप उस चैनल को प्लीज चेकआउट कीजिए. जैसे आपने इनसाइड ऑर्गेनॉन को अपना ढेर सारा प्यार दिया है, उस चैनल को भी सपोर्ट कीजिएगा. थैंक यू.
So friends, this is all about today's session. I hope you like this video. अगर आप चाहते हैं कि मैं ऐसे ही और वीडियोस अपलोड करूं तो प्लीज़ मेरे चैनल को सब्सक्राइब कीजिए. अगर आप चाहते हैं कि जो भी शॉर्ट नोट्स मैंने आपके साथ शेयर किए हैं आप उसके एक्सप्लेनेटरी वीडियोस भी देखो तो प्लीज़ डिस्क्रिप्शन में मैंने हेलो मेडिकोज हमारे नए चैनल का लिंक शेयर किया है. आप चाहे तो उसे विजिट कर सकते हैं. थैंक यू.